Hello ladies, today let's talk about vaginal discharge. Many women have this question, is it normal to have a vaginal discharge? Like any other body fluid, it is absolutely normal to have a vaginal discharge. Vaginal discharge is produced from the cells lining the vagina and the cervix. There are some functions for the vaginal discharge which includes keeping the vagina moist, lubricating the vagina, maintaining the pH of the vagina to an acidic one, and also protect as a barrier against infection. Right. So normal vaginal discharge is generally light, colorless, and odorless. However, the vaginal discharge varies between women to women, and it also depends on the woman's age, whether she is pregnant, whether she is breastfeeding, whether she takes oral contraceptive pills, etc. So many factors can influence the vaginal discharge. But non-colorless, non-odorless vaginal discharge, which does not smell or itch, is absolutely normal. Generally, the discharge varies between different phases of the menstrual cycle. Immediately after a period, the discharge is generally light and colorless. However, close to ovulation, the discharge assumes a consistency, something resembling an egg white, becomes stretchy and sticky. This is indicative of the ovulatory phase. Subsequent to the ovulatory phase, the discharge becomes thin and white. But this may not be true for all women. Alright? If a vaginal discharge is foul smelling or itchy or blood stained, then you have to visit your doctor. Okay? So there are some common vaginal infection which can lead to different types of discharge. The most common vaginal infection that we encounter in our practice is candidiasis, which is also called thrush. It's a fungal infection affecting the genital tract, and it normally produces a cheesy white discharge, and it is profusely itchy as well. All right. And women who are pregnant, who have diabetes, who have taken a recent course of antibiotic, or have done vaginal douching, they are prone for vaginal thrush, and a simple course of antifungal treatment should do the job. The second most common vaginal infection is bacterial vaginosis. This is due to imbalance in the vaginal flora, and it is not a sexually transmitted infection. It usually produces a grayish discharge which has a typical fishy odor with it, and it can be treated easily with a course of antibiotic. The third most common vaginal infection is trichomonasis. It is a parasitic infection and it is sexually transmitted. It can lead to a frothy greenish yellow discharge, and it can also be treated easily with antibiotics. The partner also need to be treated. Sometimes women may present with a grayish vaginal discharge with some burning sensation as well. This is indicative of gonorrhea, which is again a sexually transmitted infection which can be treated with antibiotics. All right. Sometimes the vaginal discharge may be blood stained. If blood staining happens outside of your normal periods, then it is a cause of concern. It can be due to either a simple inflammation in the cervix, which is the neck of the womb, or the endometrium, which is the lining of the womb. But sometimes it can be due to a more serious reason as well, like a potential pre-malignant conditions, either in the cervix, vagina, or the endometrium as well. So if you happen to have any of the above mentioned type of vaginal discharge, please consult your doctor and take appropriate steps to sort out your symptoms.